Okay, so here we are again. This is part two of the week six assignment. Okay, so we did part one. You hopefully watched that one. I explained some of the answers on those. This is part two of week six. This is the last week. This is all it is, guys. So let's give you some information on there. We're going to go through this little section here. We're going to do all 9 sections probably this way. I'll see if I can do more. I'm trying to keep them around 5 minutes, okay? Match the following terms, the appropriate definition. The inability to achieve an erection, which is called erectile dysfunction. Does it have it on here? Erectile dysfunction, yes, that's what it says. But it's also commonly known as being impotent, impotence, right? Impotence is inability to reproduce. That's what it really means. It caused by the filling of the erectile tissue by blood. The penis enlarges and becomes rigid or engorged. That would be called an erection. There we go, right there. Good. We want to make sure that we get all these correct, right? Now, the pleasurable sensation experienced during ejaculation, and this is both for male and female, is orgasm. Now, females don't necessarily ejaculate, although that's a whole other conversation. We can get into it another time. An androgen necessarily for sperm development. Androgen. Andro means man, right? Androgen makes a man, makes you more human or something, right? Necessary for sperm development and the male secondary sex characteristics. So when you release, the male releases from the testes testosterone, and remember that is some of the same hormones released by the hypothalamus, right, and the pituitary. That's your luteinizing hormones and all this kind of stuff. All this like all these hormones that are released are FSH and LH stuff released by those, and tells the testes to make testosterone, and the testes to make other chemicals and stuff, like just like it tells the ovaries to make the same kind of things. The hypothalamus, there we go. We just talked about it, inside the brain. Hypothalamus secretes these hormones, which in turn stimulates the anterior pituitary to release gonadotrophins. Gonads, right? Testes and ovaries. And trophins means to develop. Okay, that's going to be your releasing hormones. What do we got here? Releasing hormones. Sometimes getting these things to stick is hard. The gland that encircles the upper part of the urethra, when enlarged, impairs urination or dysuria. Dysuria, dys meaning difficult, urea means urination. It could be from lots of reasons, but this is from prostatitis, which is a prostate gland. Walnut-shaped gland, walnut-sized, not shaped. It's walnut-sized, really, that surrounds the proximal internal urethra, right, and leaves the bladder. The gland contributes to the formation of semen. Semen is different from sperm. Remember, sperm is the little guys, the little swimmers, and semen is everything that goes with it, right? And that's all the stuff that helps us. So imagine that's all imagine they're like your little soldiers is what we call them, right? And you have your little soldiers, but they need a lunchbox and they need a backpack and they need all of their materials. So that's what the semen is, to give them all that kind of stuff. The gland that secretes 60% of the semen. Are we going to do that twice? Releasing hormones, prostate. Oh, there we go. Sorry, it's the seminal vesicles. Seminal vesicles are just outside the prostate, and they connect to the urethra. So that's, it releases a lubricant and some other stuff that like alkaline and stuff, because it reduces the acid in the urethra and also helps the sperm also survive in when it gets out and goes into the female, right? And the also called interstitial cell stimulating hormone stimulates interstitial cells and testosterone. That's going to be your luteinizing hormone. Same in the female. Exactly the same hormone in the female. The last one here, a mixture of sperm and the secretions of the accessory glands. Now notice we didn't have one up there. There's a missing one. Emission is when it all gets moving. That's what it does. So again, this is part two of week six of your reproductive system. So we'll go ahead and end that one here, another 4 minutes, and we'll go from there. Don't forget, go back. If you're missing something, you get multiple attempts. So you can go back and do those assignments or those quizzes or whatever it is and retry. You'll remember it better that way too. Okay? Good luck, and we'll see you on the flip side, and I'll talk to you soon.